But there are problems with standards, and cranes and yards is a great example. People have worked on that in OSHA for 10 years, and it's a very it will save lives. It's a very good standard. But once a standard is written and published in the Federal Register, it becomes law. It doesn't change, and to change it takes a tremendous amount of work. The world changes, technology changes, things are learned, and we don't have a system which addresses changes very well. And of course, we don't have standards for many, many hazards. I can't tell you the number of newspaper calls we got following the death of the whale trainer at SeaWorld, because that made a lot of press. You heard 14 workers die every day on the job, but occasionally something happens where there's great deal of press, and obviously if someone's killed by a killer whale at SeaWorld, it gets a lot of press. I would explain to the reporters that yes, we have jurisdiction, but no, we do not have a standard on killer whales. Nor should we. Also, they didn't see the problem with that. But clearly, we have to take a different approach. We need standards, and we need to be able to control certain exposures. We need to tell employers exactly what's a safe way to work, or at least what's a dangerous situation they should avoid. But we can't have a standard on every exposure, on every hazard. And so what we've announced a few weeks ago is essentially a new approach, essentially we're moving toward a requirement of an injury and illness prevention program, where what employers must do very simply is find and fix the hazards at their workplace. It essentially shifts the burden. It's no longer sort of the catch me if you can model, where an employer might say, well, I'll do what I want, and then if an OSHA inspector comes, I'll take the fine, and then I'll do what's necessary. But instead, we're saying proactively, it's the employer's responsibility to assess the hazards of their workplace, involve workers in that assessment, make that plan that you develop available to your workers, and then implement it. And so we're going through that process now. We have stakeholder meetings where we want to hear from people and see what their thoughts are on that. Many employers do this, and I hear from employers all the time. We already have this, and it's great. And it's true, they do have it. A lot of employers don't, though. We think all employers should. So we're having a stakeholder meeting in New Brunswick in early June. I should know the date offhand. But if you'd like to come down and talk about June 3rd, thank you. If you can come down and speak to that, that would be really great. We're also trying to change our injury tracking system. Right now, OSHA requires all employers, not all employers, but most employers, not employers in certain white-collar industries and certain small employers who can avoid this, but we require employers, especially in high-risk industries, to keep track of the injuries that occur. To some extent, they just keep that information to themselves. OSHA asks 80,000 employers every year to send that information into OSHA, and we use that for our targeting, for doing inspections, but we don't use, that's actually only a small portion of the inspections that we make. What we do, though, is we ask an employer during the early part of the year to send us this information from the previous year. It takes about a year to get to the process. So what it means now is if I'm injured today on my job, it'll affect OSHA inspection probability 2 years from now. So that's not a great system. It's also done in a way that actually doesn't necessarily get the information back to employers and to workers. So we're trying to move to a different sort of injury tracking system. And do already what a lot of employers do now, which is essentially keep track of injuries electronically and use it to provide information about what's going on in their workplace today. So again, hazards can be examined and eliminated or abated. So we're having stakeholder meetings on that as well. We expect to issue a proposed rule, well, perhaps in the fall. That's a little faster than the injury and illness prevention rule, but both of these require standard setting. It'll take some time to get there, but those are the two main new regulatory endeavors we're involved with. There are a number of others that we're still doing, of course. Which we announced previously. We want to move to a standard around infectious exposures to protect. We already have a very successful bloodborne pathogen standard, but we need to have something to protect workers who are exposed in hospitals and laboratories and other healthcare settings, airborne infectious agents, and also just infectious agents associated with skin contact, like MRSA. And so right now we put out a request for information. We want the experience of different settings from workers, from unions, from employers, with programs around infectious disease control. And so that's another thing we're moving forward on. A lot of what OSHA does is compliance assistance. This is not as well known, but OSHA funds as many consultation visits as inspections. The consultation visits are done by state. It's done by programs run by every state. The OSHA funds 90% of the money that goes into it. We like to encourage employers to use those consultation programs before the OSHA inspector arrives. We actually find that when we send out a letter saying you have a high injury rate and we're likely to visit you, the visits to consultation programs goes up. We like to see that. And we're doing more of that. We've actually, in the President's budget, there's an additional $1 million for that program. It's the first big increase that that's seen in many years. It's certainly bigger than anything that was seen during the Bush years. We also are about to announce a new round of Susan Harwood grants. And I'm warning people about this because it'll be a relatively short turnaround time to apply. They'll be coming out in, we're expanding the categories. We will be eventually announcing grants, not just ones that are targeted to specific hazards, but also general educational grants, but also planning grants for organizations that haven't done safety health training to help get them off the ground. And so we expect those groups to partner with people and groups that already have some experience in safety health. So I think there are a lot of people in this room who could help community organizations, new labor organizations, other groups get off the ground to do safety health training, and that would be very important to us if you could do that. In terms of the other outreach, as I said, we're very much trying to reach out to non-English speaking communities, not just in Spanish speaking, but all languages. We have a lot of materials on that. We have some new Spanish language cards that I have in the back, English and Spanish, that we'd like to give out to people with our phone number. So if you can take some and distribute it, that would be very helpful. I think those are the main points I want to make. But there's one other one I want to talk about, which is something that I read about. There's just a thing in the New York Times today about LEED buildings. I'm sure you may have read that in today's op-ed page. There's a lot of discussion about energy efficiency, natural products. We read all the time about America is turning to organic food and free-range chickens and cage-free eggs, and of course the LEED buildings. But there is no discussion in this of the workers involved. That's something we have to change. We had some very serious injuries in Las Vegas a couple of years ago. Workers who were building buildings that were, they're considered models, international models of, energy, efficient LEED buildings, and actually doing some of the work that would make that led to bringing some equipment that injured a bunch of workers. And so we have to figure out ways to essentially change the way America looks at this. We have to make sure America cares more about as much about the workers as they do about the chickens, essentially. And it's a challenge to all of us, but it's something we're really going to try to take on. So with that, let me leave it at that, and let's start a discussion about where OSHA should go. And since I said I was going to end, one last thing. We are also trying to be very open in terms of getting information from people. We had a full day of, I see a couple of people who were there, called OSHA Listens, where some of the OSHA senior staff and I sat for a whole day from 9 in the morning to 6 at night, listening to stakeholders. And we have a number of different mechanisms. We're trying to get people to give us their ideas, their input, tell us if we're doing a good job, or particularly if we're doing a bad job. We have a website called Tell Dr. Michaels, not a website, but an email address where we're telling people to send things. Soon we'll have actually a web page where you can put comments in. But we really do want to begin sort of a discussion with the country around how we should be protecting workers better. And so I hope you'll very much spearhead that and participate in it. So thank you all. Let's talk about all this.